You're live now, Farah.
Great, thank you. Good afternoon, everyone. Welcome to this Food for Thought session. My name's Farah and I'm a member of the Food for Thought team. Before I introduce today's speaker, just a few housekeeping notes. Because this is a live event, your microphone is muted, so you won't be able to speak directly to our speaker, Dr. Parsons. But if you do have any questions, please type them in the chat bar on the right-hand side of the screen. And at the end of the talk, I'll read them out to Dr. Parsons to answer. Questions and comments are highly encouraged, so please do send them in if you have any. And also please note that this seminar is being recorded. Just wanted to remind everyone that we are welcoming suggestions for Food for Thought speakers for future seminars, so please drop us an email if you have any suggestions at the Food for Thought inbox. And also, we're really keen to hear about your views on the Food for Thought seminars. You should have all received an email earlier this week asking you to fill in a survey that will give us an idea of what's going well and what could be improved on, just to ensure that you're getting the most out of the seminars. It is an anonymous survey and only takes a few minutes, so if you can, we'd be really grateful if you could send us your views, and the closing date for that is the 31st of March. If you haven't received the survey and would like to input, please just drop us an email in the Food for Thought inbox. Now, it's very fitting, as it is International Women's Day today, that I introduce today's speaker, Dr. Kelly Parsons. So Dr. Parsons is a research associate in the MRC Epidemiology Unit at the University of Cambridge. Her research area is the intersection of food systems and policy, and Dr. Parsons is a former journalist and food campaigner. She's currently working on the Mandala programme, which is an interdisciplinary urban food systems research project centred on the city of Birmingham and funded by the UKRI Transforming UK Food Systems programme. And in this talk, Dr. Parsons will be sharing her insights on translating food systems evidence for people in the real world. So she'll be laying out the current state of play on the use of food systems research evidence and how we can do better. And she'll present results of a joint project by the University of York and University of Hertfordshire, which is commissioned by the FSA to develop a set of guiding principles for evidence generators to give their evidence the best chance of having real-world impact. So from all of us at the Food for Thought team, we hope you enjoy, and I'll now pass you over to Dr. Parsons for her to begin her presentation.
Thank you, Farah, very much for the introduction and for the invitation to come and speak to you today about food systems evidence. So next slide, please. Thank you, Victoria. So today I'm going to give a bit more background on me and position myself as a researcher looking at the topic of food systems evidence use. I'm going to give you some background to the Optimising Evidence project, which was commissioned by the Food Standards Agency, in which I was a part of the project team. I'm going to talk about scoping out the evidence on evidence use and applying it to food, which is what we did in the project, what we found in the project, the current state of play of evidence use, and then a bit about how we can do food systems evidence better. Next slide, please. So this is a slide about me, which I created for a conference I thought I would use today because it's quite useful. So I'm a social scientist with an interest in how policy works, including the role of evidence and all the many other influences on policy making, and how policy making processes and structures influence the food system and our attempts to make changes to the food system. So my focus is on food systems, and I'm fairly unusual in that I look across the piece from agriculture policy to diet policy and everything in between. And to do that, I draw on the policy sciences predominantly, but also sociology and system science theories and methods too. Prior to, as Farah said, prior to becoming a food policy researcher, I had a career in publishing and in food campaigning. So I have a particular interest in how knowledge can be effectively presented and in creating kind of common frameworks of understanding on which we can jointly take action around food. So I currently work, as was mentioned, in the MRC Epidemiology Unit at the University of Cambridge in the Public Health Department on a project called Mandala, which is one of the 4 large Call 1 Food Systems SPF funded projects. And it's focused on urban food systems change through a case study of the UK city of Birmingham. So essentially, it's about understanding that food system, who's in it, who holds the levers to make changes on particular bits, and from then to identify a set of interventions which we can make to improve the provision of healthy and sustainable food, while maintaining economic viability and reducing inequalities and so on. And these interventions will be made by stakeholders, which in our case includes policymakers, commercial practitioners like food businesses, and third sector practitioners, and then our team will evaluate those to understand their impact on the food system using systems evaluation and system science methods. And the reason I'm telling you about this project, Mandala, is because it's offered a really interesting opportunity to reflect further on the research I'm going to present today on the realities of generating and transmitting food systems evidence and understanding evidence use, who needs to act, what evidence we have and what we don't have, and how it does or does not get used and why. So that's a bit about how I'm positioned to look at the evidence around food. And now I'm just going to say a little bit more about the framework I use and I apply to my work, and which I think is helpful for understanding food systems in a kind of holistic way. Next slide, please. So this is the food system flower, which was developed with my former colleagues at the Centre for Food Policy. It shows the activities of the food system at the centre, so the food chain, and then the influences on and impacts of those activities in the petals around the outside on health, the environment, society, the economy, and so on. And the idea is it's a visual thinking tool to encourage systems thinking on food, albeit in a high-level way. And it illustrates this idea of food as a complex adaptive system where actions in one part of the system have ripple effects across the system. So as you can see with the spanner, if we make some procurement intervention in catering that has ripple effects or has the potential to have ripple effects downstream across other activities such as manufacturing, processing and other supply, and then eating habits and culture and values and so on at the other end of the chain. So that's one part of the picture, and it's useful for then thinking about the fact that we may have unintended consequences when solving one problem, which may exacerbate another, or positive impacts of this ripple effect if we can produce co-benefits for human and planetary health if a particular intervention is designed well, and if it draws on evidence and provides evidence on both of these outcomes or takes those into account. So next slide, next click, please. Victoria, sorry, not next slide. And one more. So you can, no, sorry, that's it. So you can also use the framework to map out the different actions being taken in the system and then think about how they interact with one another. So that's the kind of yellow zigzags on the screen to show the interaction. This has got lots of different types of policies around food, but it could equally apply to actions being taken by non-policy actors in the food system. Next slide, please. So this heat map illustrates that framework as applied. So in this case, it's a dummy model, but I have used it and others have used it to kind of score food systems research projects or interventions or policies to see their coverage of the system, its activities and outcomes. And the reason I'm showing this is because I think addressing food systems holistically has really important implications for evidence and evidence use. And we need to think more holistically about the kinds of multi-outcome evidence which are required and who might need to see evidence. And I'm going to say more about that when we get to the findings of the Optimising Evidence project. Next slide, please. So why focus on understanding food systems evidence use? So in response to pressing social challenges associated with food systems, there's this recognition of the need to transform the food system, one example, at the UN Food Systems Summit in 21, over 100 countries committed to transforming their national food system. But the challenge of translating that into reality is widely acknowledged and felt. There's been recognition that one of the critical requirements for transformation is that we need to establish better links between and across the scientific community, policymakers, businesses, community members, and political leaders, and so on. And we have lots of action being taken by policy, by practitioners around food, and we have lots of research being created around food systems. So the Transforming UK Food System programme, the more recent ESRC food system trials programme. We have lots of Horizon food system projects doing similar things around identifying interventions on food systems and evaluating them and so on. I put this box at the side of the different terms just because I thought it was useful to point out this range of different terms that are used for looking at this area, this interface between evidence and its use. And I'll say a bit more about that as we go along in terms of who different evidence users are and the different terms that are used to talk about how they use evidence and where they get it from. Next slide, please. So there's also quite a lot of activity happening at the moment around food system science policy interfaces, as they're called, which is one of the terms that are in that box. So the UN Food and Agriculture Organization is developing some normative guidance for better science and evidence-based policy processes for the agri-food system. The European Commission, there's a couple of projects there, one high-level expert group assessing how to strengthen the science policy interface to improve food systems governance, and then some more generic projects around science policy interfaces without not food specific. And then closer to home, there's work going on within the UKRI Transforming UK Food Systems programme. One of the synergy projects was a sort of add-on project which is funded to add synergistic value across all the different research projects in the portfolio, has just been funded and is just launching, and it's going to map science policy interfaces in the UK. And there's other policy engagement work happening led by the core team of the Food Systems SPF, which many of you may be involved in. Next slide, please. Thanks. So against this backdrop, I'm going to talk about this project, the Optimising Evidence project, which was commissioned by the Food Standards Agency and delivered by the University of York and the University of Hertfordshire, which is where I was working at the time the research happened. And those are the members of the team on the side of the slide there. So the aim of the project was really to understand how evidence on what works to shift people towards a healthy and sustainable diet can be better translated for and adopted by policymakers and practitioners, including retailers and other on-the-ground actors. So some of the main parameters that we worked to was, well, we were thinking about this question of why is diet shift evidence not implemented? We were asked to focus specifically on the retail consumption end of the food chain, but acknowledging that those other kind of upstream areas of the chain are also important. There was this recognition that policy was only one of many actors influencing food systems, and we really wanted to make sure that their focus on practitioners in the real world, not that policymakers are not in the real world, was in there, and we talked about the what works model as a useful approach because there was a lot of interest at the time around a what works centre around food or a number of those. Next slide, please. So to do the research, we used a range of different methods. We did some quite some extensive literature reviewing on evidence, so to find the evidence on evidence. We did interviews, workshops, and then we did sort of follow-up interviews and feedback sessions on the kind of outputs that we were developing. And we also had some expert reviewers, Professor Susan Mitchie and Nancy Hay from one of the What Works centres, What Works Wellbeing. And we had 30 participants across a range of different categories, which are listed there. Next slide, please. So the outputs of the project are actually threefold, not twofold. The main output is a set of guiding principles to encourage and support evidence users, so policymakers and practitioners, to adopt and translate the evidence on healthy and sustainable diets by helping evidence generators get the right evidence to the right users in the most effective way possible. So it's a set of guidance for those who are generating and translating the evidence to try and get it to be most effective. And then we have a technical report which gives much more information about the literature review, the conceptual framework we used, and some of the raw data from the primary research that we did. And then we're going to be producing some journal papers. So that's point 3, is some journal papers we're going to produce on different aspects of the project. Next slide, please. So our starting point was scoping out the evidence on evidence around food and evidence use. We needed to understand the current approach to evidence use and to test sort of some of these underlying assumptions about existing evidence not being implemented. And so when we started to look around, what we found was that there was some patchy but growing knowledge on food systems evidence. So there are some reports here which attempt to map the evidence around food systems and highlight some of the gaps that exist around what evidence we have and what we don't. What there isn't is really anyone looking at evidence use around food systems evidence. So there's a fair bit about what evidence we have or we don't have, but not really on how evidence gets used. So we had to look further afield than food to really understand what was happening there. This report by the OECD is the closest we could find to something explicitly looking at the topic of food systems evidence. But as I said, it's primarily about what evidence there is, not really about how it's being used. Next slide. So we wanted to capitalise on the kind of intellectual work and scholarship that was already out there around evidence use. The starting point for me, working as a food policy specialist, was the extensive literature on evidence and policy making. We have a very rich knowledge on evidence and policy, and some of that has been applied to food policy in particular. Implementation science, the literature there was also identified by the research commissioners as a framework that we should look at. And again, here we've got, a rich literature on the use of evidence by health professionals. And each of these bodies of literature is really helpful, but each has their strengths and weaknesses. So, for example, policy implementation literature looks much more about the processes of policy making and evidence use, while implementation science looks more at the instruments, so the kind of toolkits and guidance that are used in the health sector to disseminate mostly kind of clinical medical evidence to practitioners. But actually, beyond these two sort of disciplines looking at evidence use, there's this whole other range of disciplines that touch on it, and it's almost a kind of whole sub-discipline in its own right, referred to as use of research evidence, or URE. So you may be familiar with the Transforming Evidence project led by Annette Boas and Catherine Oliver. I mean, they're both real pioneers in this space, and they've created some amazing resources around it and have really helped to move on understanding about evidence use. And they've mapped this URE community, and the diagram you can see here is all of the different disciplines who have a role in understanding evidence use. But what we found when looking at all these different literatures is actually they really cover some bits of the system that's of interest to us when we're looking at kind of diet shift or food system actors and evidence. But there's a big gap around private sector and third sector practitioners. So there are they're really important actors in terms of implementing what we need to do to change food systems towards health and sustainability, but they're not really covered in this body of literature that exists. And I'm going to say a bit more about that when I talk about who these different real people are. Next slide, please. And this speaks to this sort of changing understanding of evidence use. Basically, to sum it up, it's complicated. We're kind of, the understanding is moving from what's been described as a sort of two communities theory of like a policy community and research community, and bridging those two communities to understanding these groups themselves as kind of heterogeneous and complex with multiple interactions across multiple boundaries within them. So, for example, the disciplinary differences within academia, and then government difference between administrative and political appointments. So the kind of pink and purple graphs you can see here are where the Transforming Evidence project has broken down those two kind of communities into some different types. And so there's more of a focus now on thinking about evidence use as about more like archipelagos. So there are lots of communities and they're often in close proximity, but they're nonetheless frequently separated by deep waters that discourage travel between them. And I think if we think about food and evidence use around food, we can really see that there are many, many archipelagos, because we're not just talking about policy and research, but we're also talking about these other actors that need to be involved and that we need to think about. And that's what I'm going to move on to in a moment. Next slide, please. So we also took a lot of useful material to understand evidence use from the What Works network and its outputs. So for those that don't know, What Works network launched in 2013 with the purpose of embedding robust evidence at the heart of policymaking and service delivery. And the network is made up of a set of independent What Works centres covering a range of issues from ageing to policing, but not food. And it's really useful to use their work because they've done a lot of thinking and explaining around how we can understand and articulate the evidence use process. And they use these different distinctions to describe the different stages of the process. So evidence generation, evidence translation, and then evidence adoption. And one of the problems we found when looking at all of this literature, there were so many different terms and people using these different kind of parts of the process, different terms to apply to different parts. And so we ended up creating this kind of map of the process of the way we understood it, drawing on the What Works kind of distinctions, but then clarifying some of the other usages of the terms that were circulating out there as well. Next slide, please. So the What Works network uses this idea of an evidence ecosystem to describe the particular evidence and evidence use system around a specific area of focus, so well-being, youth futures, or in our case, food. So we really wanted to apply that approach and understand the ecosystem for food systems evidence. But there wasn't really any literature on evidence around food, as I've said earlier, on who needs to act on evidence to change food systems. So we had to sort of go back a step and think more about who are we actually talking about when we're talking about our evidence users in this case. And I think this is really in itself a finding of the research project, as well as being part of our process of understanding evidence use, is it demonstrates how challenging it is for us to identify who needs to act on diet shift evidence. And the same is true for the evidence generators out there who are kind of trying to generate evidence and then deliver that to the right people who need to act on it. So I'm going to talk a bit about the public sector part of the evidence ecosystem, the users, these people, and then I'll move on to others. So next slide, please. So in some cases, understanding who the evidence users and generators are in this area, we could rely on some existing mapping work. So this is a map I did a couple of years ago, which to identify who makes food policy in England, which departments have responsibilities related to food and which influence the food system. And it demonstrates how there's at least 16 departments with a role. It's a bit out of date now, but the kind of principle applies. And if you change the names, the responsibility areas are accurate or pretty accurate still. So that's one way we could understand like who was involved in kind of food systems evidence and who might need to see evidence that was being generated. Next slide, please. There's obviously a similar picture if you go down to the local level, the city level, in terms of government there. I mean, we don't have quite the same level of mapping to draw on, but there are some examples here of where different research projects have tried to understand the different divisions and different kind of responsibility areas, more at the local or regional government level. And we know that all of these are very different, but that there are certain policy levers that are held at local level around planning, advertising, aspects of food procurement, and so on. And we're really living this reality with the Mandala project in Birmingham at the moment, trying to kind of identify which actors in the city council and beyond hold the levers to make changes in the urban food system. So we're acutely aware that this is quite a difficult challenge for those wanting to understand who needs to see their evidence. It's particularly tricky because there's not often a dedicated food department, and so you're often relying on other divisions to make changes around food. And even if there is a food team, they're unlikely to hold the levers for change in the council. Next slide. And then obviously we also have Parliament, and they're significant evidence users and generators in their own right, select committees, APPGs. There's a lot of evidence gathering and dissemination that goes on through those forums. And I would say, from my anecdotal experience, I think there's probably a more formal and transparent approach to linking evidence with users on an ongoing basis through the Parliamentary Office for Science and Technology that we don't have so much. And so I see quite a lot of activity from researchers feeding into these different forums in a way that you don't see quite so much in other parts of government. Next slide, please. And then if we think about government, public sector, we also need to think about the public sector professionals, so kind of quasi-government, and I think I've included these in the public sector because their interests are kind of more closely aligned to government than, for example, the private sector. So there are lots of different professional practitioners who are delivering on these different areas around health, procurement and education, all of which are really important in terms of their role in being at the kind of coalface of food systems and diet shift and being able to influence what happens on the ground. Again, I've been dealing with this recently when trying to address an evidence gap around healthy diets in preconception and pregnancy. A piece of work being done by the University of Hertfordshire for the Food Foundation, and we were digging into the experiences of kind of health practitioners and citizens on evidence around healthy eating, and we created a kind of poster which provides some links to what limited evidence is out there, but it's really hard to find a way to disseminate that evidence across all of these different actors who potentially could be helpful in reaching the people that need it, where it could have real world impact. Next slide, please. And then I've put this slide in. It's one that I put together for the Mandala project on institutional catering in Birmingham, just to show that actually we can go down even more granular. I mean, we may need to be more granular still, thinking about who needs to act on evidence. So actually the institutional catering sector can be divided into all these different types of institutions, and they all have their different supply systems, customers, barriers and enablers, and therefore they need kind of different interventions. And yet a lot of the evidence around procurement is really skewed towards schools and school food. So there's some gaps there that we need to recognise if we want to shift what's happening in this part of the food system. So we think we've next slide, please. So yeah, so the evidence ecosystem is much more than the public sector, the people I've talked about so far. And we think we've identified this real gap in the evidence on evidence use beyond the policy and professional kind of practitioners. And talking to the Transforming Evidence team, they said that when they talk about practitioners in their work, they tend to treat them as sort of one homogenous group, and they seem to focus a lot on these public sector professional practitioners, where, as I said, they kind of have similar goals to policymakers, whereas in reality, they're not really looking at evidence use in the private sector or third sector, despite the fact that these are really important. Click, please. Which way? Sorry, I forgot that was there. So we need to also think about these private sector and third sector actors. Next slide, please. So I'm not going to go through all of these, but really just to make the point that we often refer to the private sector or the food industry, but this masks a real huge diversity of businesses, and they all have different evidence needs and different considerations when they're thinking about acting on evidence. Next slide, please. And not quite as diverse, but also, we have lots of different types of third sector practitioners, from food charities and community groups to campaigning organisations and local food partnerships. And again, they have different evidence requirements, different things they can act on, different constraints, which I'll go into a bit in a second. Next slide, please. So one of the other things that we identified as important when exploring this ecosystem was that these different actors don't split into clearly defined and separated roles like generation and evidence generators, evidence translators, evidence users. Actually, it's much more kind of fluid and complex than that. So, and this has already been recognised in the kind of literature around evidence use more broadly. So this diagram from Results for Development shows the sort of overlaps and how different actors can be both translators and policymakers, or producers and policymakers, and so on. And what we found was, obviously, because there are so many different actors and evidence actors around food, that there's also even more of a kind of blurred role between those who are making the evidence, those who are using the evidence, and that's demonstrated in this diagram that we produced for the technical report, just to illustrate that point. So what does that mean? I mean, it means it's quite difficult to kind of understand the process, but it also means that we kind of need to reprogram our thinking away from this idea of two linear communities and building a bridge between two communities, to thinking about this complex web of interconnections between diverse actors generating and using food systems evidence. And so this slide is an example of the kind of range of actors, evidence generators and users around the issue of sugar reduction. And most of those will be kind of evidence makers, but also evidence takers as well. Next slide, please. So what we found, so that's more of the sort of background to scoping out the situation around evidence use, but we really wanted to dig down with our kind of primary research into the current state of play around evidence use around food. And we identified a set of challenges which I've distilled for the purpose of this presentation into three different themes. So I'm going to focus on the non-policy, the practitioners, because I think that's where this research project had to create the most primary evidence without any real reference to an existing knowledge base in the way that we have about evidence use in policy. So I'm going to talk about the different evidence users and their needs and sources, the fragmented evidence on the problems, and the fragmented evidence on the solutions. Next slide, please. So, as I said, we've got this lack of knowledge about that we could identify about how evidence is generated and used by private sector users. So this is some of the considerations that we identified when having done interviews and workshops, and also, through thinking about it between us as a team, about the things you need to think about when considering evidence used by the private sector. So some are more obvious, like, their primary objective is around profitability, reputation, and commercial sensitivity, which means that they have to be treated quite differently from, say, those public sector professional practitioners that I talked about, who may have more similarly aligned goals to policy. And then others maybe are a bit less obvious. So things like they prefer they're likely to prefer anonymous evidence generation methods if they're being asked to participate in generating evidence. So they don't want to sit around a table with their competitors to discuss their strategy to net zero. And I know this is something that, you know, a lot of research projects working on food systems are kind of finding out at the moment, is that, you know, they want to get stakeholders and co-produce and so on around the table. But, you know, that doesn't really work, that method, for these sorts of actors. Next slide, please. Moving on to health practitioners, well, we know a fair bit about health evidence use thanks to implementation science, as I said, but not really about diet-related health evidence. And the point I made about the kind of pregnancy diet poster sort of speaks to that. You know, there tends to be much more of a focus on clinical medical practice and how that evidence is used. Some considerations we identified here is that practitioners, health practitioners, may not actually be trained in nutrition, and if they are, they might not see any relevance to sustainability. So if we want them to kind of be acting on diet shift, those are two quite big considerations. And also they have very little time to search for evidence, so the evidence needs to be presented in a very kind of in one place in a very clear way. Next slide, please. And then in terms of third sector practitioners or evidence users, this is a really under-researched area, I think, in terms of evidence use, let alone related to food specifically. So here, some of the considerations we identified include the influences or the constraints around what they're funded to do versus what the evidence might say they should be acting on, the primary importance they have on the impacts on end users, including in terms of costs and related to any dietary changes, and the focus on immediate needs, which might be around food of any kind in a kind of cost of living crisis, rather than taking into consideration what we know about diets and diet shift and sustainable diets. Next slide, please. And then we also found out quite a bit about the different evidence sources that the different actors use. So there's quite a bit of existing literature on the different ways to get evidence into policy, different methods like policy briefs, meetings, seminars, relationship building, fellowships, and so on. Actually, there's the evidence on how effective they are shows that some of the most commonly used and recommended methods like policy briefs aren't actually that robust in terms of their effectiveness. But I'm not going to talk about that in any detail today. I thought I'd just talk about some of the sources where private sector prefer to get their evidence from. So they rely on peers and networks, for example. Suppliers can be a really important source of evidence for smaller businesses, and private sector participants also talk to us about their concerns about access to evidence, particularly in peer-reviewed journals, which they may not have access to. Next slide, please. And then similarly with third sector, we found out that they often don't have set systems in place around evidence use, for example, that they rely on data for evidencing need, in particular, for need for a particular intervention or a campaign, especially in funding applications, and that they might be part of a network which might limit their capacity to act on evidence, even if they have it. Next slide, please. I'm going to talk a bit about the challenges with accessing evidence in the field that we identified, and we divided that up into evidence on the problems, so the problems of the food system, and that includes sort of dimensions to that kind of problem bit is what's the problem, how significant it is, who's impacted by it. So what is a healthy, sustainable diet? What metrics is this measured by? Who eats what? Implications of changing diets for consumers and producers and so on, trade-offs and unintended consequences. And it's been suggested that evidence challenges around these questions are particularly pronounced because food systems are broad, encompassing food security, nutrition, environmental effects, livelihoods, and so on, as we kind of touched on earlier. And we know that diet shift is a multifaceted issue as a result of this, and that there are many different food system activities, outcomes, and that requires insights from a range of disciplines. And because of that, a single piece of evidence is highly unlikely to address all the relevant considerations for users. Next slide, please. So the challenge is that the evidence which does exist is incomplete, and this is, I think, one of the reasons why it's not acted on in the way that it might be. The evidence needs joining up across disciplines, across methodologies, across outcomes, so health, sustainability, economic, and across different food systems activities. So if we do something in one bit of the chain, what does that mean for others, and so on? Or where do we need to have complementary actions happening across different sets of activities? Then the existing evidence is fragmented and dispersed across different organisations and sectors, which makes it difficult for users to find, and that's particularly problematic around data. That makes it difficult to extrapolate findings from one context to another, and these fragmented sources also make it difficult for users to know which evidence to trust, which is why, you know, they would like to see some kind of independent body that they could go to kind of cut across all this different fragmentation. And I'm going to return to that in a moment. Next slide, please. Next slide, Victoria.
Sorry, there's a delay on my side.
Oh, okay, thanks.
Is that the right slide? Yeah,
that's it. Great, thank you. So, yeah, I won't go into the quotes, but just to say that, you know, we have a range of participants on who talked about this challenge, and, you know, talking about the need to bring evidence and data on human and planetary health together. Next slide, please. So then, in terms of the solution and the fragmented evidence there, that includes kind of ways to address these problems, what to do and how to do it. So that's which actions or interventions or solutions we should be using to respond to these problems, and then how to do that. Next slide, please. We have really rich ideas around solutions, ways to act on food systems. So this is a summary slide I produced for Mandala. We're trying to kind of synthesize some of the existing sources of food system solutions, but they're all in different formats. Some are databases, some are web pages. They have different details. So some talk about whether a particular solution's been evaluated. Some are just ideas yet to be implemented. And one of the other problems we have is that these sources of solutions are really heavily biased towards policy. So there's not good coverage of private and third sector actions. So again, we kind of only got a little bit, a part of the picture there, and not all of the picture of what evidence we need to think about making changes in food systems. And another issue is that the evidence lags behind the reality. So obviously, if we're thinking about innovative new ways of acting on food systems to transform them, then waiting for evidence to come through and be captured by different repositories is probably not going to work. Next slide, please. So some quotes here from our participants on this problem of not really knowing how to act, what solutions they should be putting in place. So, for example, one retailer talks about how the case for action, the problem is established, but they don't really know what can businesses do to act on this need for diet shift. Next slide, please. So the last theme I want to cover is around how we can do better. I'm going to whiz through these slides because I'm conscious of time. So I think there are a range of things we can do better to address some of these challenges that we identified and kind of take into account what we've learned about the evidence use around food. So they're individual and then some more structural things. So I'm going to just talk through those now. If you could do the next slide, please. So in terms of individuals and individual organisations, how we can do better, we can ensure that individual evidence generators make their evidence as effective as possible. And so this is the aim of the Guiding Principles report, which has been an output of this Optimising Evidence project. So we've developed this set of guiding principles by taking all of that evidence that I've talked about and then turning it on its head. So if this is the challenge, fragmented evidence across health and sustainability, what do we need to do? What evidence generators need to do in order to make the evidence more applicable for users. And then we've combined that with existing literature on how best to generate and translate evidence, but making that specific to food as a kind of topic area as a sector. And then for each principle, we've included a checklist for evidence generators to think about and examples of best practice. Next slide, please. So these are some of the examples of best practice which research participants flagged to us and which we've signposted to. I haven't got time to talk through them, but basically there are some kind of pockets of good practice out there which we can build on. Next slide, please. But we also need to make sure that the way we kind of address these issues is not just left to individual agents, be that individual researchers or organisations. We need some more structural supports in place. So one of those is to get our evidence in order. You know, there's lots of tried and tested ways of doing this that are circulating out there: evidence gap maps, evidence synthesis tools, and you know, we don't really have any of this that's been applied to food. So the evidence gap map is about agricultural innovation, but and there's some about food security in lower middle income countries, but not really anything around diet shift area as far as I know. And this is the Education Endowment Foundation toolkit for assessing how to intervene around education, where it looks about effectiveness of evidence and cost effectiveness of acting and so on. We don't really, this is exactly the kind of thing I think would be really useful to have for food. So, and then longer term, I think, you know, we can do some of this without too much investment and resource, but longer term, I think, you know, these calls for a body to curate the evidence are really worth considering. You know, we had multiple participants saying that that's what's needed in this situation, and we have some examples that we can point to, the CCC, what work centres and so on, that we could be looking at. Next slide. We could also build on some existing tools that we have, so areas of research interest and thinking about how we might translate those better, and kind of help researchers, help evidence generators to understand what exactly is being looked for. And I don't know if there's a way that we might be able to think about doing something like that for the private and third sectors, so that we're not missing that part of the picture there. We have, you know, the food systems SPF, the food system trials, and we have lots of activity in Europe, as I said, you know, and I think we need to be working to ensure that they're sharing the evidence that they're creating, both within their projects, but also more widely. And then we have these initiatives like the Food Research Collaboration and Table, which try to kind of make these links across the different actors and provide kind of a more rapid kind of evidence reviewing of food systems issues, as well as disseminating the information. Next slide, please. And then we have this issue around transparency, which I think we could really improve. There are some really good pockets of transparency around evidence use, of which, you know, the FSA consultation response is a good example. The National Food Strategy Evidence Compendium is a really good example, but they're patchily applied, and so we need to kind of make sure that those sorts of approaches are being taken across the board rather than just here or there. And partly, I think, you know, there's a problem of the way that the gov.uk platform is tricky to navigate to identify those evidence use examples. Next slide. So these are my final two slides. So first of all, coming back to this question of translating food systems evidence for people in the real world. So why is diet shift evidence not implemented as well as it could be? It's complex, the ecosystem is complex, there's lots of users, different needs, some are not well understood or targeted by our evidence as a result. There are gaps in the evidence, the existing evidence is fragmented and it might not be aligned to what users need or to a holistic approach. And we need improvements in generating and translating the evidence in effective ways which maximise the kind of efficiency and resources that are being spent in this area. Next slide. So just reflecting then on what the kind of contributions of this optimising evidence project have been, I think the fact that we've detailed this food system evidence ecosystem is really valuable. We've created this preliminary map of food system actors, which I think, you know, there's definitely more that could be done around that. And we've sort of positioned food evidence within this wider scholarship. We've identified and addressed in part this kind of gap on private third sector practitioner evidence use. And I think, again, there's much more we could do to understand the evidence use in those different areas. And we've created this guidance, which is specific to food, which didn't exist before. And the implications of it is that we need to kind of follow these principles of good evidence generation and translation, and also improve the structural arrangements for food systems evidence. And I just wanted to leave you with this final thought, which is kind of something that's been on my mind in relation to Mandala and kind of identifying interventions, and this idea that, you know, of course, we want to make sure that we have evidence on what works, but at the same time, if we're trying to innovate for transformation, what does that mean for our use of evidence? And, you know, what, you know, is there a kind of tension there between trying to kind of create evidence-based interventions, but then also trying to kind of not just stick with the kind of business as usual approaches, and look at ideas that have already been kind of evidence and implemented, because, as I said, there's a time lag there. So if anyone has any thoughts on that as a kind of topic, you know, how do we evidence innovative interventions in the food system, then I'd be really interested to discuss it. And that's it. Next slide, please. Thank you.
Thank you so much, Kelly. That was really interesting and insightful and really important work, and lovely to hear about it. And I'll open up to questions now. So if you've got any questions or comments or thoughts for Kelly, please just pop them in the chat and I can read them out to her. We've got a question in the chat at the moment. So the food systems heat map that Dr. Parsons presented looks like a really valuable tool. Is this, or will this be available or published for external use?
So I haven't, it's not been published. It's just something I've kind of used and shared informally, and I'm happy to do that. Yeah, but yeah, it's not been published anywhere formally, but it's not the first time someone's asked me that, so I should probably do something about it and publish it.
That's great. Thank you, Kelly. While people are thinking of their questions, I just had a question on, you mentioned potentially evidence repositories could be generated or exist. Would I be right in thinking that kind of the proposal would be that evidence generators, once they've generated their evidence, would then kind of store their evidence in the evidence repository, and then that would allow all the different sectors to have access to that? And kind of a follow-up to that, if so, how do they make sure that the relevant sectors and the relevant parties are actually seeing that evidence?
Yeah, I mean, that is the kind of role of a What Works Centre, is really to kind of curate the evidence, and then people know where to go to kind of for the best kind of synthesis and kind of analysis of the evidence. So yeah, as kind of a more modest approach would be, so the work we've been doing for Mandala around sort of solution scanning and then pulling together these different kind of sources of different kind of ideas for interventions, you know, we're thinking about, and we're trying to get a bit of funding to kind of build out that database of solutions so that people can at least look to see, okay, if I want to impact procurement, or if I want to make a change around procurement, what is the long list of things that we could possibly do, with a view to then building out onto that with some kind of details around whether there's evidence of effectiveness and so on and so forth. But, you know, there is a lot of challenges. Others have tried to create these sorts of databases of policies or, you know, measures, and the problem is they need a lot of ongoing upkeep. So it's like, how do you service that on an ongoing basis? We can create a kind of database, but at the same time, then, you know, the nourishing database, which is probably the closest we have to something like that, where it's a nutrition policy, national level nutrition policies, then you know, they have a dedicated staff that upkeep that. So yeah, that's one of the things we're thinking about. What might that look like?
Yeah, thank you.
Does that answer your question?
Yes, it does. Thank you. And in terms of kind of the format of the evidence that we're talking about here, is it more kind of raw data format, or is it more kind of a lay format? And would kind of the format of the evidence be a barrier to people using it or seeking it?
Yeah, I mean, I suppose I'm thinking about it probably biased towards the sort of solutions side of the evidence, whereas the kind of is a different kind of subject, thinking different kind of matter, thinking about the sort of evidence around the problems and so on. I think that's, I mean, I think a lot of that is captured in the National Food Strategies Evidence Compendium, and I think, you know, it wouldn't take a lot of work to kind of bring together all the existing sources on that, to kind of put them in one place and make them accessible. I mean, the evidence in that review is very accessible. So I think it's, yeah, I think it's scientific evidence, but presented in a way that can be understood by non-academic readers personally. So I guess that would be the sorts of approach I would advocate for.
Thanks, Kelly.
Kelly, can I just ask, so I can't get into the chat quick enough, what other kind of engagement have you done with this research?
So we did some initial meetings with some of the kind of actors working around diet shift and what works for diet shift. When the project wasn't quite finished, I planning to do a presentation to the Food Systems SPF across the one of their seminars to basically disseminate the evidence across those research projects. And I'm going to talk to the programme team about what else we can do. And I am in touch with their knowledge exchange fellow who, you know, this is her kind of area really, is thinking about knowledge exchange around the programme. So, and she's, you know, she knows about the guide, and we've talked about how we can kind of look to implement it within the programme. And then I'm also working with that programme to try and create some kind of learning exchange between the EU Horizon food systems projects and the Food Systems SPF here, to think about how we can kind of share lessons, and part of that I hope will cover the sort of principles and the evidence use ecosystem that we've kind of uncovered with this research. So
thank you. Well, if the Food for Thought team or even the FSA can be any more help, do get in touch.
Thank you. Yeah. Oh, actually, we're making a video as well, practicing what we preach, and making an animation that's being organised by Bob at the University of York. But yeah, he's created some kind of animation, so that will be a bit more of a kind of easy to access summary of the kind of principles. And I've done quite a lot of stuff on social media on it too, which has been really well received. There's a lot of interest in this. There's so many researchers being told to have impact and influence policy around their food systems research that they're doing at the moment. So everyone's really kind of keen to know how to do it.
If only there was one magic answer.
Well, exactly. Yeah. I mean, but at least better to know that it's complicated, but map out what the kind of challenges are and what some of the solutions might be. And I think the guiding principles are really practical in terms of what they suggest to do. And there's lots of signposting to good examples of things that have been done, or evidence on what works and so on. So hopefully it's of practical support.
Thank you, Kelly. Any final questions in the last minute? I think I'll wrap up then. So thank you so much again to Kelly. That was, as I said, very, very interesting and really relevant to the work of the FSA and to a lot of sectors, as you've highlighted. And thank you everyone for joining us today. Have a good day.
Thanks.